Okay, we're ready to get back started. Thank you for returning for the second half of our wonderful event. As you can see, we have a panel. They're up on a nice little podium here. We have Dr. Mark DeBrava, who is a regent and a practicing physician and a graduate of UNR, University of Nevada, Reno School of Medicine. We have Kathy Thomas Gibson, who is the Community Outreach Manager for the City of North Las Vegas. We have Julie Shamil, who is the Project Director for Tripp Umbach. We have Vance Farrow, who works for, I'm reading and trying to translate at the same time. We have Vance Farrow, who's the Industrial Specialist in Healthcare for the Nevada Governor's Office of Economic Development. And we have Brendan Bussman, who is the Vice President of Strategic Development and Marketing at Sunrise Hospital. All of them have a very unique perspective, both on healthcare, on the economy in Southern Nevada, and sometimes in an actual municipality. So I'm going to let them tell you kind of what they do and what are their optics on the idea of having a med school in Southern Nevada. And then we will go into questions from the community. Vance, if you want to start.
Sure. Am I good? Am I on? Okay. As Maria said, I'm Vance Farrow. I'm the Industry Specialist for Health and Medical Services within GoEd. And I came to this job a little bit over 19 months ago, and I saw some immediate gaps in service delivery, and everybody would tell me how our shortages are so great, I said, well, how big are they? Well, they're just so great. I said, well, okay. I think it's key for us to be able to determine how deep the ocean floor is, and in doing so, I think that we have opportunities to address those through a medical school, allopathic medical school. And I moved here from a small place, maybe many of you have heard of it, probably Washington, D.C. And there are three very strong, very vibrant medical schools for a population of a little over 600,000. So when I look at a community that's a third of the size of the valley and I see three thriving medical schools, I don't think it's a question of whether or not there can be three thriving medical schools in this valley, because I'm sure that there can be. And I have worked with the folks from Roseman. I'm working with the folks from Thoreau. I'm working with folks at UNLV, because I think that there is no ceiling when it comes to what medical care can be in the valley and in the state, even for that matter. And I don't see her, but to another point, we are already attracting folks in the umbrella of health and wellness travel, and I think that it's important for us to highlight and point to those opportunities, whether they be siloed a little bit. And Doug, we were just talking, we don't do a good enough job of promoting what we have and telling our story. So I think, and I'm sure that bringing additional school to the valley will help us do that.
Thank you, Vance. And I just want to say on that point, for anybody, there's quite a few people here who may have attended. There was a meeting in the spring with Stowe Shoemaker, who is our new dean of the School of College of Hospitality and Tourism. And I think that, Southern Nevada has the opportunity to make a huge impact in healthcare and creating a nice connection between making healthcare friendly. There's plenty, if you just Google hospitality and healthcare, you don't always see those connections. There's plenty of stories of when people don't feel like their healthcare is friendly, when they feel like they're a number, when they don't feel like they are actually cared for individually. And there's an opportunity here to connect those, and I think that's one area where we can be unique and make a whole new name for Nevada outside of the many, many names we already have. Brendan, would you like to?
Sure. Brendan Bussman, Vice President of Strategic Development and Marketing for Sunrise and Sunrise Children's Hospital. I'm assuming you're all out there, but these lights just are blinding. So if I look dazed and confused, I apologize. But appreciate the opportunity to be here, and Rob and his group for hosting this good and important community discussion. A little bit about Sunrise. Sunrise has been around and in the community for a little over 50 years. Largest hospital in the state. both on the pediatric side as well as the adult side. See the most hearts, level 2 trauma, Nevada Neuroscience Institute. But more importantly, we're strong partners with a lot of the academic institutions here, both from the across all medical facets, both with Roseman, with Toro, with the School of Medicine up in Reno. We see between residents and students just on the medical doctor side and the DO side, well over 200-300 people each year. That doesn't include what we're doing on the nursing side, pharmacy, and everything else. So we are very committed to helping train our future medical providers in this community, and glad to be a part of the discussion today.
Thank you. I asked Julie, who is part of the Tripp Umbach organization, to be on the panel because she not only was out in the community and conducted a great deal of the interviews in person, but she also called a whole bunch of people. And sometimes got a lot of love, sometimes maybe not. But so she participated in many interviews and had the opportunity to, of course, help author and give some of the optics on the report. So she's here. Julie, do you want to say anything?
Yeah, like Maria said, I'm Senior Project Director at Tripp Umbach, and my role was to actually guide the project. So again, with economic impact studies, we always start with reaching out to the community and speaking with key stakeholders. So again, I probably spoke to you as well as my colleague Angie Lockwood, whether it be in person or over the phone, to get your insight on medical care as well as education and so many other areas of the project. So we started out with reaching out to you folks, and then from there we went and move forward with the actual project in itself, as for developing the models and writing the report and so forth. So if anybody has questions about the themes maybe that came up through the stakeholder interviews, like Maria had mentioned earlier, we had conducted over almost 60 interviews and of the interviews.
The feedback is from self. I'm not sure whose or what's. It may be mine, so I will turn mine off. Since mine happens to be a landing pad, With that brief interruption, and I apologize if it was mine, and I will stand like this the rest of the day. Kathy works at the city of North Las Vegas, and she is out in the community, and I believe she brings such a unique perspective of the community. Kathy, do you have anything you want to say?
Thank you. For those who are not familiar with Southern Nevada, North is a jurisdiction, not a direction. And so North Las Vegas tends to fall at the bottom. If Nevada's at the bottom in the nation, we're at the bottom of the state. So in terms of health outcomes, our communities are, pick a illness, pick a community problem, and North Las Vegas is experiencing it disproportionately compared to other communities. So obviously we're very concerned about health and health outcomes. In fact, our Visioning 2025 plan identified developing and attracting more healthcare professionals to our city as part of our vision for the next 25 years. And so I'm charged with comprehensive community initiatives for the city. And that just means if they don't know where to stick it, it's my responsibility. And that is where health and wellness has ended up. And so for the past 5 years, we've been working on reestablishing public health clinics. The health district closed the health clinics in our community, for an example. So we had to work to reopen those. We've been working with small providers so that we actually have more primary care. And I'm very glad to say by the end of the year, we'll have 2 or 3 clinics opening their doors in North Las Vegas. And for us, that's a huge accomplishment because they didn't exist before. So we understand long term that we've got to have more of everything, more primary care, more specialists, more allied health care. We need everything. And so the discussion about should we or shouldn't we have a medical school is a no-brainer for us. Oh, by the way, there are about 1,900 acres set aside in North Las Vegas for the expansion of UNLV. Many people don't know that. And of course, it's tied in with some Bureau of Land Management issues. And once those are resolved, we didn't erase it off the map because we all kind of went into economic tailspin. It's still zoned, it's still there. 1,900 plus acres in North Las Vegas for UNLV campus. A third of that is specifically designated as research and development. So we're thinking, great, med school, research, works for us. We are committed partners to this, and this is not an academic conversation for me. I work with the teenagers. We've got the highest teen pregnancy rate in the state. We've got the highest suicide rate in the state. We have more diabetes, more chlamydia, more, pick something. There's more of it. And so for me, this represents an opportunity to not just talk about the challenges, but talk about the opportunities. 60% of the land in North Las Vegas is undeveloped. You don't have to go to the 1,900 we got set aside for you. There's plenty. Lots of infill in our downtown core, near North Vista, for example, where we have small, almost mom and pop, one doctor and a receptionist kinds of operations. We can't scale that up to serve the needs of North Las Vegas specifically, but the Valley in general and the state as well, if we don't sort of broaden our lens. So this isn't a conversation about, is this something we can do? This is something we must do. We must do it. And so that's my perspective, because I'm literally on the streets every day talking to the people who are trying to figure out how to make this work for themselves, and all the options that are available. Affordable Care Act, what does that mean? Nobody knows what it all means, and so it's important that the conversation continue on multiple and parallel paths, because this isn't a academic conversation for most of the people who live here in Southern Nevada.
Apparently, I don't get along with mics, so there you know, now we know it. Thank you, Kathy. And I actually am going to take a little bit of facilitator option, and I'm going to ask Dr. Mark DeBrava a question. As both a graduate from UNR and a practicing physician, I want to ask him about the medical school, and just several times over the course of the day, it's been mentioned about its underperformance and its impact to the state. And I want to ask about his experience and what his perspective is. If you could share that with us, please.
Sure. I'm, like Maria said, a proud graduate of the University of Nevada School of Medicine, and also a graduate of UNLV for my undergrad. And I did my residency in Louisiana and came back in 1997, and got involved with alumni associations, and of course, as a physician, took emergency room call at University Medical Center and saw how the faculty were interacting, and I was glad to see that. And I just want to shout that out right now, that if I give constructive criticism, I hope it's considered constructive. In no way am I saying that I have a problem with our faculty or students or staff. They are fantastic. I'm proud to call them colleagues. I served 3 years on the admissions committee for the School of Medicine, and we have fantastic students that are applying and getting in. And it's just, I'm very proud of the School of Medicine. But it was closer to 2010, and I decided to run for regent because I was so proud of the School of Medicine, but on the other hand, so frustrated. So I'm going to start to contradict myself, but I think I can explain. I saw how the School of Medicine was definitely a casualty of the North-South struggle in politics. And I said, gee, how do you try to fix that? And I said, well, maybe become a regent. And then maybe you can say, what's the most politically sensitive, emotionally charged issue I could bring up? And it's the medical school. And I think I've done that, and I also want to say thank you for my fellow regents who are here to learn and to participate. And I must say, Chair Levitt of Health Sciences has been very open, and we want to discuss this, and we have had it at some public meetings. And like I told my fellow regents, I just want information to come out. And I think what the report showed, the biggest thing that I'm taking away from it is it can lift Reno rurals, and Southern Nevada. So I really see it as a win-win. Yeah, we have to figure out finances, but when you look at the healthcare delivery system, the University of Nevada School of Medicine has been underperforming. They aren't a major participant in healthcare delivery, in my opinion. And I think that can change over time, and I like that it would be a homegrown solution, UNR, UNLV. I first thought, maybe when I got on the board, that it could be just further expansion of the School of Medicine, the Reno School of Medicine. But having been on the board for 2 years, almost 3, I came to a conclusion in my mind, no, I don't think that's the right answer. I think there has to be a separation, but continued collaboration. And when I look at philanthropy potential, that's one reason that I said, hey, no, it has to be a UNLV product down here to get the Southern Nevada community to buy into it. Right now, the School of Medicine in Reno, they are down here, and they're doing a wonderful job, but they're not embraced by the community, and they have an identity problem in the community. So I figured, what's at UMC, School of Medicine now, could we come up with a plan that would phase into a UNLV med school, and the UNR school would participate predominantly in Washoe County and the rural counties? And I think there is great discussion going on right now. I mentioned to Lindy that I have her same passion, being a resident of Southern Nevada. And I mentioned that I had a phone call with Dan Claich, and our chancellor was very receptive. He and I talked. I think there's so much common ground. I think if you can keep the emotion low and let the facts come to the surface, I think it's going to be a solution that the state's happy with. What was your question, Lee?
No, that was perfect. Thank you. And so now, I really want this just to be a discussion. If there's any questions from the audience, the community, yes.
Yeah, I just want to get really the thoughts of the people on the panel. One of the important things, and we were talking outside the room, is that there's a big difference in terms of the research and other, okay. There's a big difference between the ability to conduct high-quality research, to attract researchers, and any number of other things. If it is a medical school hospital, UCLA hospital, etc., Hopkins Hospital, then if it's an affiliated hospital that is sort of a home to a residency program. In Reno right now, the dean is having some, has put into place, obviously, with the leadership of Renown, a group that is looking toward what kind of collaborative effort there can be. And I'm thinking, what can also be done in Las Vegas so that as this develops, there is the best of all possible worlds in terms of resources for the medical school, the residency programs, so that it's not merely producing what's essential, which are physicians to take care of patients, but also all of the other things that can go together with it. Because it's unlikely to have a University of Nevada, Las Vegas Medical School hospital come out of the ground. What can be done? Well,
What would include
not a
both the-
holistic approach.
Well,
of,
let me
yeah,
finish.
Okay.
Would include both research, clinical practices, and extensions, including possibly organizations such as hospitals and community centers. And because if you look at the Affordable Care Act, it would include those things as well.
That's not what I'm asking. I'm asking purely hospitals, because in terms of research dollars, what can be done to bring them into the fold in an academic way?
We have the VA hospital out in North Las Vegas, brand new facility, and I think they already participate in maybe in a small amount of research with the School of Medicine, and I think there's a lot of opportunity there. I think as a public hospital, our county hospital, University Medical Center, we've had the longest standing relationship with the School of Medicine. I think that would just get stronger and stronger. I don't think there's any intention of the university getting into the hospital business.
No.
Yeah, and, okay, so, but what I also see is if it is a potential UNLV program down here, it can make a lot more inroads with the HCA, the Universal Hospital Systems, Dignity Health, and I think there can be definitely coexistence with Turo, the osteopathic program. If Roseman continues and says they're going to have a program, there are plenty of hospital beds, there are plenty of patients, there's plenty of clinical activity to tie into.
But you need good quality academic researchers at hospitals
And
to
Brendan?
integrate with the med school. And that
I would just say from the Sunrise perspective, we have about 200 clinical trials going on right now.
How many are investigator versus pharmaceutical?
I don't know those figures off the top of my head, but I know we have roughly about
Yeah.
200 going on right now. Obviously, that's some of that's public, some of it's private. You know, and I think whatever you see in a blend both today and down the road has to be a public-private partnership to move forward. You have to have those of us in the private sector supportive of what's going on in the public sector to make this all work.
And I also would be remiss if we didn't include places like Cleveland Clinic as well, who does do research, and that could be included into this discussion. I don't think that we don't have the perfect idea of the mix now, but those are all ideas that we can explore as we continue to go as discussed. And Paul mentioned both in his report, when you look at it, making sure that all the clinical options were explored, and that's why he suggests not just one person coming up with a plan, but having a team approach, that all the key stakeholders would be represented to make sure that those kind of options were fully explored.
Yeah, I just want to say hospital partners here in Las Vegas, but also in Reno, are critical to making this work, and that the research of the future is going to be more on the hospital clinical side than in the traditional labs. The second thing that's critical going forward is to make sure that as we're discussing this, that we're able to have that coalition formed, not just for research and clinical expansion, but also for graduate medical education, so that we can have all those subspecialties trained here too. So that's a very good point. And I think that the medical school announcement and the plan will give life and energy to those partnerships, because who's going to go first? Hospitals aren't going to go first. They're going to come in partnership. So I think that's important.
We have a question. Go ahead, Vince.
I did a rural loop trip around the 50 and up the 80 and around, and we cannot omit communities that are ready for graduate medical education simply because they don't have it yet. I spent a little bit of time in Elko, met with Kevin and some folks there, and that community is ready for a graduate medical education. Senator Hardy and I met with Ed Epperson and folks at Carson Tahoe, and they are ready to expand graduate medical education there. And it is certainly the case here in the Valley where we need to, statewide, where we need to at a minimum double our GME numbers, because what we don't want to find ourselves in is the physician exporting business.
Right.
And so what we have to do, equally as important as building the opportunity to create physicians, is making sure that we have the ability to retain them after they go through their medical education on the professional level, and then we're able to put them into graduate medical education programs within the state. And then, again, to a point that you raised, there are a number of companies that our office is working with that are interested in coming in. They have question marks about their ability to be sustained over time, whether they're adult stem cell research, whether they're pharmaceutical based, whether it's medical device manufacturing, robotics, things of that nature, but they see opportunities here. And with the advent of this report and what they're hearing with regard to the Roseman School, which is imminent, and what can become a UNLV school, they are excited about that. They want to be kept in the loop on that, and they're willing to step out first and say, you know, if you guys are serious and get these things in place, we are willing to come. And I've got literally a page full of those folks that are willing to make that investment. So it is the commercialization of what has become what everybody looks at the Texas Medical Center and says, wow, they really did it. But I can assure you that their first step, they didn't think, we want to be the Texas Medical Center. It was, you know what we have a basic need and we have some ideas about how to fill it. And then what came after was some research and some lab space. And then what came after was partnerships with industry. And then what came after was another school. And it grew to what it is now. But believe me, they didn't know that it was going to be what it is now when they first took that first step. So it's all part of the growth.
There's also federal opportunities that include things like the Indian Health Services. There's a lot of, native lands here that would include the public health services that could also be expanded to include services that would also be can be part of the GME as well. That would not only bring physicians and offer physicians opportunities, but also pharmacists and public health workers as well.
Hi, my name is John Files. I'm a professor of surgery and also the medical director for the Trauma Center at UMC. And just to inform the conversation, in the 16 years that I've worked here, we've been able to attract probably over $12 million in research funds from CDC, NIH, and Department of Defense. We're finishing out with Army and Navy right now. And we're entering into an agreement with the Air Force, Sentinel-S, to become the Western Sea Stars training site, which will bring more research assets to us. Right now in our general surgery program, we graduate 3 civilian and 2 active duty Air Force residents every year that blend right into the community. Almost all of them stay here. And I just want to inform the conversation because it's been a struggle. I feel like I've been an island, and the Department of Surgery has been an island. We support a huge basic science laboratory that's in a dental school building, and with 5 FTE scientists in it. And so when I was on faculty in Chicago, it was easy to walk across the hallway to the physiology department and say, hey, I was on trauma call last night, saw the strangest thing. What do you think we can make of that? And I don't have that opportunity here.
I just wanted to make the point based off of
Wait, please, there's a mic coming to you.
I just wanted to make the point based off of that it's extremely important, as we keep on mentioning community and we keep on saying community, that when you talk about community, that's your physicians. And it's extremely important to keep your physicians involved throughout this process, because at the end of the day, they will be teaching these residents and they will be teaching the medical students. So having those personalities and those type of atmosphere coming to this, to the environment is really helpful for that. And I'm glad that you talked about that, because it is a struggle for you, but having those resources available can really help, and having those physicians input is very important. So I would keep on championing for that, and I would love people to stand up and keep on talking about that.
And I think just something to bring another point home, Evan Klass and his group with Project Echo are doing an excellent job at bringing those kinds of opportunities to the forefront. For those of you that aren't familiar with that program, ECHO stands for Extensions for Community Health Outcomes. And it is a program where they bring together, they bridge folks in rural communities that don't have access to specialties, don't have access to be able to treat difficult patients, to the urban medical center, where you've got folks around the room that specialize in various treatment modalities. My first day there, they were providing information to a small town where they were treating a woman that was 5 months pregnant, had just shown up for her first day of prenatal care, and was already hypertensive, was diabetic, depressed, and I don't know, one other thing, not that she needed one other thing, but she had that other thing. And they walked that provider through 3 or 4 very viable opportunities that provider didn't consider, and were able to get this woman under better control within 2 weeks. And that is exactly the kind of opportunity that we need to grow and spread in Nevada. And I think that I applaud Evan and his group for what they're doing. And I think that being able to create that bridge, both north-south, and be able to connect those folks to the medical centers that we have in UNLV and in Reno, and again, growing ones in Elko and everywhere else, that I think that folks don't have to feel as isolated as they feel now. And that should be an integral part of what we grow as a medical education center.
Thank you. We have a question.
So this is geared more towards Paul and the folks from Tripp Umbach. Was any consideration brought into the analysis of the fact that we have a virtual population that travels through Las Vegas of 40 million a year? And furthermore, we have a tremendous amount of healthcare professionals that travel through here for medical meetings each and every year. And is there opportunity to attract some of those physicians that are coming here in terms of almost a traveling physician faculty member to help seed the board for the new med school?
It's a very good question, a very nice concept. I think that at one level, I think all of us were very impressed with the dynamics of the region, and the reason why we didn't predict that the economic impact would be 600 or 700 million, which would be typical. We actually went to 1.2 billion for a lot of the things you mentioned. We think there's opportunity for destination medicine. As far as faculty, from an accreditation perspective, it would be very difficult to have traveling faculty. But from a medical education conference, seminar program, you have unlimited opportunities for physicians to come here and engage. It's already happening. You know, there are many medical related conferences that already happen here. This is the meeting capital of the world, so healthcare is a big part of the world. I think that you could really create much more of a dynamic virtual faculty, not on the accreditation side, it would never go through, but more on the continuing medical education side. And what would be great is if I was a medical student here and I could have access to every one of these conferences and meetings that relate to medical, I'd have more opportunity in Las Vegas, probably even now, than 90% of the places in America, just because I'd have that access point. So I think it's a great idea.
Mm-hmm. I'm sorry, I don't mean to keep chiming in, but I've got a lot of stuff up here. As we are sitting right here, we are hosting the global MTA meeting. That is the Medical Tourism Association meeting that's taking place at Caesars through, Thursday? I was in a meeting all afternoon on Sunday with ministers of health from all over the world, and a lot of them were here for the first time, eyes wide open about the assets that they didn't believe existed here, excited about the opportunity to go and see the Lou Ruvo Center, excited about the idea of learning about the number of, the unbelievable point, not knowing that so many people come here for knee replacements, hip replacements, not knowing that people come here for plastics and bariatrics. And we're doing that. But to your point, we aren't telling that story well enough. But medical tourism, medical wellness, and travel is happening here every single day. If you look on the books of Comprehensive Cancer Centers of Nevada, a fourth of their patient population comes from out of state. And those folks are coming here because they feel they're getting the best care here. And there are groups, there are organizations, Spectrum Pharmaceuticals, where they've got $1 billion plus market cap in their cancer R&D and the drugs that they have in a global footprint platform, and they are looking to partner locally. We've had conversations with UNLV, conversations with Roseman, and we are going to be the springboard for their research and development. So it's just a matter of harnessing that power and then making sure that we provide what industry is demanding and make smart decisions on that aspect.
If you were a doctor and you happened to be here for a conference and for one brief moment you thought, well, wait, maybe I can participate in medicine here. We have so many barriers and so many, we literally make it impossible to get your medical license transferred here. It could take 2 weeks straight of a physician's time, 12 hours a day, and he probably still wouldn't finish the paperwork or get an approval. That's a legislative change. Yeah. While you're at it, change the Constitution and let's start taxing mining. I mean, that's how hard that is. Add that to my list. Anybody?
I will say that there was a bill this year that went up in front of the legislation to change how doctors could get their access to practice. It did not pass. Hopefully in the future It will, but I do agree with you. I know when I first got here, well, actually, Vance and I started about maybe 2 months apart. You came about 2 years, and so we looked at that, coming from different states and having, both of us having parents in the health field, we looked at that. And I have a family, a plethora of family members in the health field, so knowing what they have to do to change license, it was a surprising fact that there was not a period. In many states, what you have is you have a period of time of like a year. If you are in good standing in one state, you can come and practice in another state as long as you're in good standing to get all of the paperwork and all of the license filed, so then you can practice with a period of time to get all of those straight in here. There has been stories, if any, Dr. Zubin Damania, who is head of Turntable Health, who was part of the downtown project with Tony Shea, his story is that it took him somewhere in the rounds of about 6 months to get his license approved, and he was coming from Stanford, and it was because it took him some time to be able to get, he had to go in front of the board. And also they want some things that doctors are not always known to be the best paper organizer type. And so they wanted, I went through the actual application page by page, and they want things like, what was your GPA when you graduated? What was your MCAT score? And those things, I mean, that's like asking me what my GRE score was, and I can't tell you. And I'm sure, and so I know that there's also a matter of trying to find that information out, which can be very difficult. So that is a barrier for doctors coming here to practice. And I know that I was in a focus group not too long ago, and there was an organization who brings doctors in to practice here, and they have a whole department set up just to bring doctors here so they can practice. Those resources could be used for something else if the laws were made a little bit more friendly so doctors could come here to practice if they're in good standing. We're not saying we want to bring the person who just, cut off somebody's finger because it felt good to them. We want to bring the people who are in good standing in one state and allow them to practice while they can get their paperwork done in a timely fashion.
Maria, can I comment on that, please?
Absolutely. Here, you can come get this one.
Thank you. My name's Andy Eisen. I'm a pediatrician, formerly residency program director at the University of Nevada School of Medicine here in Southern Nevada, currently an associate dean at Touro University, and I represent Assembly District 21 in the legislature. Whew, okay. So trying to figure out all the perspectives I'm trying to bring today. And actually, Senator Hardy and I worked on the very bill that you're talking about. And I think, for one, I'm going to throw out a bit of a cautionary flag on that. And that is, and I think we discovered this, it's very easy to say we should be able to get somebody a license quickly if they're in good standing, but you have to have a process to establish that they're in good standing, which does in fact take some time. I will tell you that I did my residency out of state. I was born and raised here in Southern Nevada. I left the state to go to school. I did my residency out of state because at the time there was no pediatric residency in Southern Nevada. Came back here to help build the pediatric residency that we have, a program of which I am very proud. And what I will tell you in terms of getting doctors here, getting them licensed here, the key to that, without question, is graduate medical education. It is residency programs. I got my license coming out of residency. My residency ended on June 30th, and my license was active on July 1st. It really wasn't a problem, and I was out of state. But if we can train those graduates of medical schools, whether they graduate in Nevada or they graduate out of Nevada, if we get them here to do their residency and we get them licensed here, it is far more likely that they will practice here. And I think that the emphasis needs to be in terms of developing the physician workforce, and there's certainly a lot more to healthcare than the physician workforce. We still need to talk about the nursing workforce and physical therapists and occupational therapists and psychologists and everybody else. But we really need to be focused on how we're going to develop the graduate medical education programs in order to train physicians here who will stay here. And we are at the national average for medical student density in the state of Nevada. We are ranked 21st in the country. We are at the bottom and well below the national average for residents. And the national average is 16 residents per 100,000. Nevada has 11. And we have no programs in a variety of fields, in anesthesia, in physical medicine and rehabilitation, in pathology. Those graduates have to leave the state, and they don't come back. And I think there's got to be a real heavy focus there. And what I'm hoping that we get is a clearer connection
with how we will develop those GME slots in order to develop the physician workforce.
Every very good point. Every new medical school in America have been successful when they've developed the graduate medical education alongside the undergraduate. And that's a strong recommendation in our report. But I think even bigger than that, without that, you've really kind of spent a lot of money and didn't get a lot of physicians, and you need so much more. And I think the out-of-state physician issue, I really like your point, has to be addressed. But the best way and easiest way is to just create a pipeline in the state, and you won't have a problem with that.
My question actually follows up on Dr. Eisen's question and your answer somewhat. I understand, as someone who's done a lot of consulting himself, that you didn't have an unlimited scope of work and you weren't hired to solve all of our healthcare problems. But my further understanding is that we've had 16 years of a national freeze on residencies. And I guess my question for you is, what role did that play in your report? Did you, in a sense, assume it away, assume that we'll correct that? Will the limit on residencies, as we produce 60, 120, 480 additional MDs, will the limit on residencies vitiate the healthcare benefits? Will it vitiate the economic benefits? Or what did you think in your mind as you were doing the study and making your recommendations and findings and conclusions about how that interacts with the GME problem?
Very good question. I want to just say, first of all, that is an assumption in our study that there will continue to be the cap. We can't do any work without having that assumption. So we believe the cap on residencies stays. But I think one thing that would really help everybody in the audience to know is that the cap on residencies is only with places that had residencies in 1996. For places that haven't gotten residencies yet, they can still develop them, but you need a medical school and you need very strong partnerships within the community medical system and physicians to do that. So the cap is only on places that already had it. So many hospitals in Las Vegas could get federal funding under the old rules for residencies, and that's what we're going to be working on. The second thing is that we've been able to recently around the country develop multiple residency programs where the private sector, health insurers, and other funders have come together to help pay for the startup costs, and then the federal funds click in. It's about a $3 million per program lift to get a residency program going before the federal funds start coming in. And we've been able to successfully start them. So what we're talking about when we say 240 more residency positions, what we're really saying is we need to go to places that qualify to get federal funding and help them get those started. And I think that Nevada's got a great opportunity because you have so many what we call virgin hospitals. Virgin hospitals in Las Vegas. Just think about that. It's very interesting.
We have a question here.
Hi, my name is Stacy Tavino, and I currently serve as the Lincy Professor of Law at the William S. Boyd School of Law here at UNLV. And this is not really a question, it's just a comment. We are so excited about some of these possibilities here, and I just wanted to throw out the School of Law as an area of expertise. I have so many colleagues: Ann McGinley, an expert in disability law; Jeff Stemple, an expert in health insurance law. I teach healthcare quality and liability, healthcare organization and finance, bioethics, mental health law, etc. So whether we're talking about licensing issues or almost anything else, if there's any help or any support that we could provide, please let us know.
And I just want to follow up to what Paul had said too about virgin sites. The VA hospital is a virgin site, and I had spoke to a representative at the hospital. He was very excited about the study and partnering and so forth. So again, it's just making those connections and going out there and seeing who has these available spots so we could work with them and get them, started. So.
Jeff Klein, I'm the president of Nevada Senior Services, and despite the misnomer in our name, we're actually a community not-for-profit organization that delivers a wide range of chronic disease management services to both the young folks with chronic diseases through the elderly, and are engaged in evidence-based research in partnership with Stanford, the Rosalind Carter Institute, and a number of other major institutions around the country. That said, coming back to the GME issue, one of the foundational problems we have is in Nevada is this explosion of population we had and the aging out of that population at probably the fastest rate of any region in the country. We have not the luxury of the infrastructure that much is available in many other parts of the country. So from a GME perspective, we have little or few, and then sometimes no, physicians in some of the core specialties that we would most like to retain folks in coming out of the school. So we have no Andrus Center here in geriatrics. We have no Rancho Los Amigos in rehabilitation. We could go through the list. I think from a planning perspective, something that needs to be reacted to is how we create graduate medical education in areas where, from a physician perspective, we're starting at ground zero.
Does anybody have a comment to that?
Well, I do. One thing that, from an economic development perspective, is to look at what we don't have and try and figure out how we can put those things together.
Right.
There is if any of you are familiar with the project that took place in Boulder City, where they were able to expand their services through USDA funds. USDA sits in the background as an organization with several hundreds of millions of dollars that they're willing to invest in seed projects that look to address those kinds of, untouched issues. If I could wave my magic wand, we would already have a shovel in the ground creating a mental health teaching hospital, which is something that we have an entire HIPSA designated area of mental health, health professional shortage areas, for those that don't know. But we have other health professional shortage areas, as I'm sure you know, in several specialties, mental health being one for sure. But we have the opportunity to create those. And in just working with Kathy's office, we know in North Las Vegas, and it's a win to be working on bringing those 2 clinics online and then being able to rotate GME that we want to rotate through those clinics for primary care. But we know that we haven't even begun to scratch the surface. We could put 20 more in North Las Vegas and still not meet the need. So, there is not a shortage of opportunities to engage our residents. It's not a question of where the patients are going to come from. We've got them. Everybody in this room is going to be affected because when you call to make an appointment for your next checkup, you're going to wait a little bit longer than you waited a year ago because of the Affordable Care Act and other things. So, you've got all of these folks that are coming online that are going to have health insurance, which is going to increase the time that you're going to wait to be seen. And so the only way we're able to combat that is by creating more opportunities for folks to be able to receive health care, and we're going to do that by growing the numbers of physicians and growing the GME that we can to retain them. So it's something that has to work in tandem to meet the needs that you're suggesting.
Thank you. We have a question, comment here.
Pretty much a comment. My name is Kevin Melcher, and I live in Elko. So be careful on the gold mine conversation there. But at any rate, I came on the board the same time that Regent Dubrava came on, and one of the things I ran my campaign on was on statewide collaboration. And my district now goes deep into Clark County as well, so I get to travel a lot. But when I first met Dean Schwenk, the first conversation I ever had with him, it was a comment, and I told him, and he refers to it every once in a while, is that if there's anything that we can do to bring this state closer together politically and financially and everything else, it is healthy health education in Nevada, because everyone can get behind it. No one I've talked to doesn't understand that there's a need in Las Vegas, in the valley here. In rural Nevada, 44 doctors per 100,000. I mean, that's the quiet one out there, and Dean Schwenk has done a great job of keeping that on the radar as well. So I think what we need to do is make sure that we talked about the floor. We talked about the history is behind us. I don't think there's a person in this room who caused or created some of the negative tensions and things that exist. And we need to always remember those because we learn from those, but we need to move on. And my hope is we'll come out of this with people talking positive talk. We have a good med school. It's just not serving all the needs of the state. It's not that the quality isn't good, it's just not big enough, and it can't operate in the whole state like we wish it had. We need funding. We need positive comments. We need positive support from all areas of state. I love the idea of having the same presentation in the Reno area. That's a great idea. And I just think when we come out of this, we have to come out with good positive support from everyone, from every part of the state, or we will really delay ourselves from getting there. In the legislature, in philanthropy. Yes. I mean, if we're arguing about this, who's going to give? Right. We have to say, no, we think you should give. We want people in Reno saying, yeah, you should give to the University of Las Vegas Medical School. We want people in Las Vegas saying, yeah, give to both, or give to. We want Elko. We want the mines to give. Right? All right. That's my comment. So if
and I wanted to make a comment, and dovetails also with the professor from Boyd Law School said. Part of it is everybody doing the piece that they can do. So talking positively about what other folks are doing, but actually doing the piece that you can do. So I work in a municipality. This is something happening with the regions. It's happening at a state level. What does the city do? The city says, we're going to market our down payment assistance programs, doc on the block. So while you're still a student, we can get you into a house where you're paying a house note for less rent. You're more likely to stay if you buy a house, and there's an opportunity to do your residency in that community. And so we'll do what we can do. So if the medical community develops the residencies, we'll develop the first-time homebuyer programs and market it specifically to that group. What are we doing now? Vance mentioned a couple of these clinics. North Las Vegas doesn't have much money. That's not a secret. What we do have is land. So we say, okay, we'll give you this land for $1. And when you build that clinic, you must create opportunities within that clinic for someone to do a rotation. So someone who's going to work on public health or primary care physician, someone doing a residency on one of those tracks, you have to provide that opportunity because we just gave you land that you didn't have to pay for. We're going to waive all those dumb, put 3 trees here and 2 benches there requirements so you don't have some of those issues. We'll make it easier for you to build if what you're building ultimately serves a greater purpose. Right. And so everybody doing the piece that they can do to support the larger movement. So it's not just throwing rocks, because we do that, throw a rock, hide our hand so nobody knows where the negative stuff came from. It's not just talking positively. It's also acting in the lane. I'm going to stay in my lane. But I'm not going to veer over into yours and upset yours because you're driving an 18-wheel and I'm driving a Yugo. I'm going to drive my Yugo and get to the destination. I'm going to bring what I can bring to the table so that the whole process moves much more quick. It just sweetens the pot. It's like down payment assistance. What does that got to do with, well, no, maybe it's not GME per se, but if I can get that person housed in a house that they own more cheaply than they can pay rent, well, now they're tied into the community in a different kind of way. Everybody needs to do their piece and understand how their piece connects to this larger piece.
There's just to dovetail really quickly on what Kathy said. When we talk about medical education, we keep on talking about doctors, but healthcare is not just doctors. It's a CAS tech that will be that can be educated at CSN. And it's the orderly, and it's the people who clean the hospitals, the people who keep the SIMS lab running. And so it's not just the top 8, 10-year, 20-year education track. It's a very wide track of education. So it would be a benefit not just to the medical school, but to UNLV, to CSN, to the high school. And at Houston Medical Center, they actually just started a high school that's integrated into Texas Medical Center. So it can integrate all the way down through. We hear often about how Clark County Schools is working and trying to increase their STEM work. So it doesn't it's cross-cutting. It's like taking a pie, it's like taking a cake, a really big fat cake, and cutting it across the middle, because it goes into each section. It's not just one. The med school may be what we think is the top tier, but it goes across all the tiers, down from preschool all the way through. And there's many things that can attract and to make the cake a little bit sweeter. I just had to throw that out there. I wanted to ask Mark a question. What needs to be done to engage the private sector of physicians into this discussion? And is there a voice, or would it have to be a one-on-one discussion with the physicians?
You know, from my experience practicing 17 years, being a member of the Clark County Medical Society and on the board, you know, we have to recognize that the private physician community, there's, you know, majority are good physicians. And we physicians suffer when we say, gee, Las Vegas is home to the doctor that killed Michael Jackson. We're the home to the gastroenterologist who had the biggest hepatitis infectious disease problem in the United States. You want to talk about medical tourism, you got to fix that first. So there's a perception across the country that there's no medicine in Vegas. So putting a statement and billboard is a UNLV medical school. We're serious about medical education. We're serious about healthcare. The talk of graduate medical education is so important, but you have to anchor it with the medical school that's going to make that graduate medical education of the highest quality. We don't want to just open up the licensure so everyone can come here like in the 60s and 70s. This was the place they would come to hide if they couldn't get good practice in other states. So you want to send the message, we're into quality and high standards of healthcare. And the private physicians will say, that makes sense.
Because one thing that I've noticed is sometimes there seems to be this idea that there is a limited pool. And I want to really reiterate that this pool is, as Vance said, the ocean's big and deep. And there's a lot of swimming to be done. And so we can have, I think that there could be 2 or 3 med schools here in this area, and there would still be plenty of work to do in healthcare in this area. There'd be plenty of areas of expertise to be developed, to be exercised, to be grown, creativity in healthcare that still could be done. And I think that we can really engage in some really creative structuring and building to create a really nice healthcare spectrum here in Southern Nevada. Are there, I know that,
Yeah, just one thing.
1 second.
Yeah. One point with respect to an expansion of residency programs to obtain new ones is many residency programs have difficulty filling, okay? A new residency program is likely to have significant problems filling their match with quality applicants. And I think that's something that has to be recognized. Certainly there are medically underserved areas throughout the state, but quantity is necessary, yet quantity of mediocre minus trainees is not necessarily what you want if you want to not have the sorts of history that you mentioned, okay?
2 things. One, I know Paul has done an awful lot of work in developing GME programs. If you could take the mic to Paul, please.
I can answer that. I think there's been a 30% increase nationally in the amount of medical students that graduate because there's been new schools and there's been expansion. And last year, for the first time, we actually had folks that could not find a residency because there's more students now and far few residencies. Residencies have not grown at the same amount. But I think the gentleman brings up a good point, and that is that if we don't have the pipeline to fill quality students in the quality positions, you end up probably not where you really want to be. But I've looked at the residencies that already are in this region and statewide, and they do fill. And I know that the residencies like in surgery and others have done well. I think, though, that down the road, you're going to find that there'll be even more medical students that are looking for quality residencies. So I feel that one of the things we have to put on the table is that we need to have the highest quality programs and residencies. But I have not found in our study that that is the case. Actually, I found the opposite. Gentleman over here from the surgery residency, they fill and they put out a very good product that stays in the community. So I feel that right now it's a good time to develop the medical school and residencies because the time is right nationally. And also there's a national physician shortage that's so great that it's not just here in Nevada, it's really everywhere. So question. Right. Exactly. Right, exactly. And that's why having the highest quality, that's one of the reasons why I am recommending a partnership medical school to build on the assets statewide, to have that highest quality school here, and then to have the highest quality residencies be built on that. So who gets the mic next? Okay.
Yes, I just want to say that, several of us just got back from the AAMC, and this a combination of all the new medical schools opening, four-year campuses, partner campuses opening and starting to graduate. In the last couple of years, we've actually had the first time forever in our country where U.S. graduates from mainland allopathic schools have not been able to find a residency program. So I think the timing, as others have said, is right. So I think the tide is really turning. So I think it's a good opportunity for us. And I would just make just a general comment on the School of Medicine. My perception is we're getting better and better residents who are starting with us as every year goes on. And so I think that will also contribute to the quality.
Thank you. Does anybody else from the panel have any other comments?
AAMC, and a while ago, AAMC, in recognizing the national shortages that will be, or that exist and will continue to exist, simply put out a blast to medical schools to up enrollment. And, they have responded. And we're seeing more schools, we're seeing larger classes, but we did not see that cap, that residency cap, go up, which adds to the notion that people in Washington don't talk to each other. But point being, we have to be incumbent upon ourselves to push that as we grow and not find ourselves in a position where we are exporting that talent. To your point, we do a very good job of filling our slots. We don't have slots that go unfilled, and we actually are better than average at retention. I believe the current rate is in the 70th percentile for folks that stay where they're trained. We're 6th in the country, and a lot of people don't know that. We're 6th in the country at our ability to retain the folks that we actually train. And so that already puts us at a curve ahead of where the average folks are because of what we have to offer. So I think that building on what we have is a good reputation for training. I mean, yeah, we've got some black eyes for sure, but that's not who we are. That's who they were and what they did. And so there is a difference, and we will grow from that. And I think that part of this conversation and what's going on is certainly a step in that direction. But we have what it takes to get there for sure.
Thank you. I think we have two comments, one here and one over there, and then I think Rob has some closing remarks.
Thank you very much, Maria. For the record, my name is Regent James Dean Levitt. I'm the current chairman of our Health Science System Committee. Dr. Dubrava, our vice chairman, and we have members of our committee here today. The chancellor earlier today referenced an MOU that was recently just signed last night between the two presidents of our research institutions, UNLV and UNR. At our December 5th, 6th Board of Regents meeting, For all of you that are interested, I would invite you to attend. There will be public comment. There will be a 1-hour full board presentation of this memorandum of understanding. It's a historic document. It emphasizes heavily the collaboration and partnership necessary to expanding medical education, both in northern, southern, and rural Nevada. So for those of you that are interested in this, please feel free to weigh in. My understanding from Chairman Page is that there will be a public comment period at the beginning of that item, so that any of you that want to further inform us, we'd love to see all of you there.
Two comments. I appreciate the comments already shared and then the talks, everybody coming the distance. Two items I'd like in the school is, number one, have classes for people that want to go and learn about their body without having to go for a degree. People know more about what's happening in Hollywood and on the football field than they know about their, the basic lymph system and circulatory system. And secondly, we have two companies in Nevada, Affinity Water and Ironways or Alcoways up in Reno, and they produce an alkaline water. And many individuals, there's a book out, You're Not Sick, but You're Dehydrated. And many of these communities are crying for health care when they need to turn to the people and say, you need to hydrate, and you need to hydrate with better water because everything clears up with the water. That's some things that I'd like to see incorporated in the school, even though they're maybe not for a degree. Thank you.
Thank you. Rob?
I just wanted to thank everybody for participating. Let's give a round of applause. And to say, let's keep this conversation going. Thanks. Enjoy the rest of the day, folks. Bye.